Your orthodontist sees your child's teeth about every 6 weeks. We see them every single week. Here's why that changes everything. Most parents don't realize that traditional orthodontists only check progress every 6 to 8 weeks. That means if something stops tracking in week 2, a bracket breaks, and a liner doesn't fit, no one knows until your next appointment 2 months later. That's 8 weeks of zero progress, 8 weeks where your teeth aren't moving, and 8 weeks where you're still paying. And now your finish date just got pushed back. In Wellington, where your family calendar is packed with sports and tutoring and dance competitions, you can't afford treatment delays. And yet the typical orthodontic system is designed around provider convenience, not yours. Here's what I've learned after treating 20,000 patients in Wellington over the last 20 years. The biggest source of frustration isn't the braces themselves, it's the waiting. Waiting 2 months to find out something wasn't tracking. Waiting for your next appointment when you know something feels off. Waiting in the office for 45 minutes before you even get back to the chair. That's why we monitor our patients every week using advanced remote monitoring technology. And it's included in our fee because this is how we deliver high value care. By the end of this video, you'll understand why weekly monitoring isn't just more convenient. It's the reason our patients finish treatment faster, with fewer visits, and without the hidden time drains that derail traditional orthodontic care. Here's how traditional orthodontic works. You bring your child in every 6 to 8 weeks. The orthodontist checks their teeth, adjusts the wire, or swaps the aligner out, and sends you home. Repeat for every 18 to 24 months. Sounds fine, right? Except there's a hidden problem. If a bracket breaks in week 2 or an aligner stops tracking in week 3, no one knows until your next appointment 6 weeks later. That's 6 weeks of zero progress. Teeth aren't moving, you're still paying, and now your finish date just got pushed back. I've had parents come in for their 2-month checkup only to discover their child stopped wearing elastics weeks ago, or a tooth wasn't tracking properly, and now we're behind schedule. The frustration in their voice is real. Why didn't we catch this sooner? The answer? Because we only see you every 8 weeks. In a traditional office, that kind of delay is baked into the system. You don't find out there's a problem until it's already cost you weeks of progress. And in Wellington, where finishing before high school matters, every delay compounds. Think about what that actually means for your family. Your child's in braces for an extra 3 months because a problem that could have been caught in week 1 wasn't discovered until week 8. That's 3 more months of avoiding certain foods, 3 more months of extra brushing and flossing, and 3 more months where they're self-conscious about their smile. And it was completely preventable. We check your child's teeth every single week, and here's how it works in our office. Every week, your child takes a 60-second scan at home using a small handheld device. Those images are sent directly to me. I review them. I look at every tooth. I check the fit of every aligner or the position of every wire. If something's not tracking, I know within 7 days, not 60. The advantage is immediate. And if a liner isn't fitting or a bracket needs attention, we catch it that week, we get it in, we fix it, your treatment keeps moving forward, and there's no downtime, no wasted weeks. The teeth are always progressing because we're watching every single week. As a parent, you're not wondering if things are on track. You're not second guessing whether you should call the office because something feels off. You send the scan, we review it, and you get peace of mind. If there's an issue, we address it immediately. If everything's perfect, you keep going. Traditional orthodontists see you every 6 to 8 weeks over the course of treatment. We see you every single week for the entire duration. That's 6 to 8 times more doctor oversight, and that level of supervision is what keeps you on schedule and protects your finish date. Your orthodontist sees your child's teeth about every 6 weeks. We see them every single week. Here's why that changes everything. Fewer office visits without sacrificing results. The traditional model is built around provider schedules, not yours. In a typical orthodontic office, you're coming in every 6 to 8 weeks, whether you need to or not. That's 18 to 20 visits over the course of treatment. Each visit takes you out of work, your child out of school, and eats up 1 to 2 hours when you factor in the drive time and waiting. Here's the paradox most parents don't expect. More monitoring means fewer visits. Because we're tracking you weekly, we only bring you in when there's a reason. A new wire, a new set of aligners, a necessary adjustment. We're not scheduling appointments just to check in. We already checked in digitally this week. According to the research published in the Journal of Clinical Orthodontics, remote monitoring has been shown to reduce in-office appointments by 30 to 40%, while maintaining improved treatment outcomes due to early detection of compliance and tracking issues. Most of our patients come in 30 to 40% less than traditional orthodontic visits. Instead of 18 to 20 visits, you're looking at 12 to 14 visits over the course of treatment. That's 6 to 8 appointments we just brought back to you. 6 times you didn't have to leave work early. 6 times your child didn't miss school. 6 afternoons you got back. And the results are better, not worse. Because we're catching issues immediately, treatment actually moves faster. There's no wasted time waiting for a problem to be discovered at your next appointment. The teeth are always progressing, which means shorter treatment time, less time in braces or aligners, and healthier teeth, and you finish on schedule or ahead of it. Time is super important. You have work, you have family, you have sports, you have activities. And to sit in a doctor's office for an hour just to be told everything looks good, see you in 2 months, it's an incredible waste of time, and we don't do that. If everything's tracking perfectly, you don't come in. You send a scan, we confirm, you keep going. Treatment finishes faster because we eliminate delays before they compound. The dirty secret about traditional orthodontics: most delays aren't caused by your child's teeth, they're actually caused by the gaps in supervision. When you're only checking progress every 6 to 8 weeks, small issues turn into setbacks. An aligner that wasn't fitting in week 2 becomes a 2-month delay by the time anyone notices. Here's what's happening with weekly monitoring. We catch those issues in week 1, not week 8. That means your child's teeth are always moving. There's no downtime. There's no waiting for the next appointment to find out something stopped tracking. Every single week, we're evaluating progress and making sure treatment is moving forward. I call this the momentum effect. When teeth are moving continuously with no interruptions, no delays, no oops, we need to go back a few step moments, treatment finishes faster. We're seeing patients finish in 12 to 16 months instead of 24 to 30 months. That's cutting treatment time nearly in half. And it's not because we're rushing, it's because we're efficient. What that means for your family: less time in braces means healthier teeth, fewer months of avoiding sticky feuds, fewer months of extra brushing and flossing, less cavities, less risk of cavities, and most importantly for Wellington families, finishing before high school. Your child isn't walking into freshman year with braces, they're walking in with a confident and beautiful smile. One of the things I'm most proud of is how we finish on time or early. And that's not because we're not letting small problems snowball into big delays. We're monitoring every week, we're staying on top of it, and that protects the timeline you were promised when you started. Emergency reduction. You don't have to wonder if something is urgent. Here's the scenario every parent dreads. It's Thursday night, your child bites into something and a bracket pops off. Or an aligner feels like it's not fitting, right? Now what? You call the office, interrupt your week. Do you wait until the next appointment in 6 weeks and hope it's fine? You're stuck guessing. With weekly monitoring, there's no guessing. Your child sends a scan, we review it. Within 24 hours, we tell you exactly whether this needs to be addressed immediately or whether it can wait until your next scheduled visit. There's no panic, no unnecessary trips, no wondering if you're overreacting or underreacting. I've had moms text me at 9 p.m. worried that something broke and treatment's not going the way it should be. They send a scan, I look at it. Most of the time it's fine. It can wait. Occasionally it needs attention and we get them in the next day. Either way, they have an answer, they have peace of mind, and they didn't waste a trip to the office just in case. This is a hidden time saver that parents don't always think about up front, but it becomes one of the most valued parts of our system. You have direct access, you have visibility, you're not in the dark wondering if something's wrong. Some orthodontic offices charge extra for this kind of access and monitoring, and we don't. It's built into our fees because this is how we deliver high value care. This is how we respect your time, and this is how we make sure nothing derails your child's treatment. If you're a parent in Wellington and you're starting to research orthodontic options for your child, here's what I'd encourage you to do. Don't just ask about price. Don't just ask about how long treatment takes. Ask how often the orthodontist will be monitoring your child's progress, because the difference between checking teeth every 8 weeks and checking them every single week is the difference between finishing on time and falling behind. It's the difference between 12 visits and 20 visits. It's the difference between peace of mind and constant worry. At Shullman Orthodontics, every patient is monitored weekly. It's included. It's how we deliver high value care. And it's why our patients finish faster with fewer trips and without the delays that derail traditional treatment. If that sounds like the kind of care you want for your child, visit our website or give us a call. Accountability and compliance, the hidden factor that determines whether treatment works. Here's the honesty most orthodontists won't share. The technology works, the braces work, the aligners work. What doesn't always work is getting a 13-year-old to consistently wear their rubber bands or keep their aligners in 22 hours a day. And if they're not compliant, treatment stalls. You're paying, time is passing, but nothing happens. And according to the American Journal of Orthodontics and Dental Facial Orthopedics, patient compliance, particularly with removable appliance and elastics, is the single greatest variable in orthodontic treatment outcomes. Studies show non-compliance can extend treatment by 6 to 12 months or more. Here's the problem with traditional orthodontics. If your child stops wearing their elastics in week 2, the orthodontist won't know until week 8 at your next appointment. By then, you've lost 6 weeks of progress. Weekly monitoring holds them accountable. When your child knows Dr. Shullman is looking at their teeth every single week, behavior changes. This isn't about being punitive, it's about keeping them on track. I'm not trying to catch kids doing something wrong. I'm trying to keep them moving forward to their goal. And when they see the progress happening every week by week, they're more motivated to stay consistent. It becomes a positive feedback loop. I've seen this play out in hundreds of times. A parent will come in frustrated because their child isn't listening about wearing elastics. We start weekly monitoring. Suddenly, compliance improves. Not because the child changed overnight, but because there's accountability, there's visibility, and kids respond to that. So here's what we've covered today. Traditional orthodontics checks your child's teeth every 6 to 8 weeks over the course of treatment. We check your teeth every single week. That's 6 to 8 times more supervision. That weekly monitoring means catching problems immediately, not 2 months later. It means fewer office visits because we're only bringing you in when there's a reason. It means faster treatment because there's no downtime or delays, and it means no guessing when something feels off. And it means higher compliance because your child knows we're watching every week. And all that adds up to one thing. You finish on time with fewer trips and without the hidden frustrations that make orthodontic treatment feel like a burden.